You can think of hospital home as the newest unit to OHSU, an innovative care model which essentially it allows for the care services that traditionally have been limited to the physical hospital setting, but instead now we can do that within the comfort of the patient's own home. A good hospital home patient is someone with the appropriate medical diagnoses who's clinically stable and is able to engage with their healthcare providers in using virtual technology. Patients are tethered to their nurse and physician care team 24/7, just like they would be in a physical hospital. When the patient is transferred from the emergency department or the main hospital to home, the technician accompanies them home and helps set up that tech in the home. Technology includes an iPad, which allows the patient to be connected to their care team 24/7. So with one touch, all they have to do is tap the iPad and that generates a video call to their nurse team. So anytime they need anything, if they have a question about their medication or if they want to talk to the doctor, it's the same thing as like hitting their call light here in the hospital. We also provide the patient with an emergency response bracelet. It looks a lot like an Apple Watch. So let's say that they're away from the iPad and they need help. All they have to do is tap the screen of this bracelet and that calls the nurse. Other parts of the technology install are the help button box, safety monitoring devices. We make sure that the Wi-Fi is working. We also install a backup generator and backup Wi-Fi services. Patients get their vital sign monitoring devices, so blood pressure cuff, pulse oximeter, a scale, which is especially important for our heart failure patients, and then a concierge-style telephone, which is a direct line to their nursing care team. There are a lot of things that we can do for patient care in the home. We can do IV antibiotics in the home. If the patient needs intravenous fluids, we can do that. Simple imaging like radiographs, EKGs, even ultrasounds, we can bring the imaging service to the patient's home. They don't have to come back for that. Labs can be done at the home. We have a phlebotomist come out to the patient's home, draw the labs, and then we courier them back to OHSU, and they're run here on campus. All those results are displayed within our electronic medical record. We have access to physical therapy, occupational therapy, dietitians, social work, case management, just like we would here in the physical hospital. Hospital home is safe, and we take steps in the very beginning to make sure that the right patients are entering the program. So we go through a rigorous screening process with our nurses and our physicians to make sure that we're getting the patient at the right point in their care. I really do think it is the future of medicine. Patients have shared with me that they really enjoy getting hospital-level care in their own home. COVID really shifted how we deliver care. So even in the outpatient clinics, when it wasn't safe to have that direct physical contact with patients, a lot of them shifted to doing virtual visits with their patients. And so this was a very natural transition for inpatient medicine, again, for the right patient to care for patients in their own home.